So tonight we're going to be talking about the changing landscape of substance use and treatment. And we are definitely seeing a lot of, we've just in our little preemptive conversation here, we've been talking about some things that are definitely need our attention. So really excited about our panel this evening. My name is Kim Porter. I'm the executive director of Be a Part of the Conversation. Also with me tonight is Judy Hirsch. She's our director of community engagement. And we have a terrific panel that I'll introduce you to in just a moment. First, I want to thank our community partner, Montgomery County Office of Drug and Alcohol. We are so grateful to have been partnering with the county for many years now, and we have a very full year of programming ahead that I hope you'll join us for. So here's our panel, and I think Sarah is having some issues getting on to the program. So I'm going to start with Amanda, if you don't mind, but Sarah will be with us, I'm sure. I'll tell you more about her when she joins us. But Amanda, I'm so glad that you're here. She's the Gaudenzia's corporate outpatient director. I'm sure she'll tell you a bit more about her role. You're also going to be hearing from Claudia Herman, who's with us from the Montgomery County Community Recovery Center. She's their coordinator. And you'll get to hear a person in recovery share their story. That's Andrew. He's with us as well. So grateful to have you all here. I'm going to stop sharing now. And Amanda, would you like to get us started?
Sure. Let me just pull up my presentation here.
Sure.
Thank you. I like pictures, so I brought a presentation to show you that. So let me just move my toolbar here. All right. So my name is Amanda Jernigan. I am a corporate outpatient director with Gaudenzia Incorporated. We are a large behavioral health company in Pennsylvania, Maryland, Washington, D.C., and Delaware. We serve and have facilities. I work in the outpatient division. So my job is to oversee all of our outpatient clinics and work with different drug task force, probation offices. I work with adolescents. We have some adolescent services in our Dauphin County area, which I help run and oversee. So we're going to look at some drug trends across the board and talk a little bit about how they're regional, how some are more related to adolescents than others, and those types of things. So just get to the next slide. Maybe. Oh, there we go. So we still see a lot of marijuana as a drug trend. I just want to say that marijuana is not what we're used to seeing, not what your grandma used to smoke. Most marijuana is manufactured in labs, and that it gives them the ability to make it more powerful and has a higher potency than just like marijuana that's grown in a field and dried out and smoked. So that is something that we see more. Anything that's made in a lab is what we consider designer drugs. And we see different strains of marijuana, which we haven't seen before. And depending the effect you're trying to get out of marijuana depends on the strand. So sativa is more of an energizing effect. Indica is more of a sedating or relaxing effect. And then there's a hybrid, which is a mixture of indica and sativa. So this is something that people who smoke marijuana, they seek out individually specific strands, depending what they're looking for and the desired effect. From marijuana, we see a lot of edibles, and I always bring up edibles, especially this time of year, because when I grew up we'll just say a long time ago, when we went trick-or-treating, I remember my parents going through candy looking for razors because that was a concern. And it wasn't that many years ago that there were stories of kids being given marijuana edibles during trick-or-treat season. So this is something that's become very important and very a big issue, because accidentally these get ingested by smaller children and purposely sought out by adolescents as well. But edibles is a big thing. They look a lot like the regular things. The second picture these are peach rings, which are a common candy. A lot of kids love them. A lot of adults love them, I should say, too, but they're infused with marijuana. So they give you THC content. Some other things, these are some other pictures of some things. These are THC infused toothpicks. So this is something that anyone can use and chew on a toothpick. We don't think of that as anything really as a big deal, but in actuality, it's infused with marijuana. The picture on the right is Nerd's Rope. And I just want to take a moment and pause and talk about marketing, because most of the stuff that we see geared towards kids or marketing is things that are common, and our brain just looks at it quickly and says, oh, Nerd's Rope. Most adults don't like nerds because they're like little tiny like little crunchy sugar pellets. Most adults don't like it. Kids crave it because, of course, it has sugar in it. But if you look carefully, above the word nerds is the word medicated nerds on a rope. So these are THC infused nerds ropes. Again, your brain just goes to the nerds and just sees that and thinks it's innocuous and not a big deal, but in actuality, it is something. Things that are common, again, the marketing piece. You look at these things quickly. The one on the far right is Berry Boss. That's THC infused Captain Crunch cereal. And then one in the middle is Stony Jacks, which is marijuana infused Applejack cereal. And then the one on the left is Doritos, which is THC infused Doritos. So again, Doritos doesn't look the same, but the other two do look very similar to the boxes of cereal, and your mind goes to that marketing piece. We see a lot of people, especially young adolescents, coming in with cannabinoid hyperemesis syndrome. And this is something that we see because of the potency of marijuana has increased so much. We see it mostly in people who smoke long-term, weekly, daily marijuana use. They report having severe belly pain, episodes of nausea and vomiting. We don't really know why, but they report feeling much better after they take a hot shower. There's no single test that confirms this diagnosis. The only thing that makes you feel better is if you stop smoking marijuana. And if you get better, that's how they confirm the diagnosis. But we see this, and a lot of people are being treated in the emergency room for this. LSD has made a pretty big comeback. We see this with the young adult adolescent population. It's coming back, and it's something that adolescents are seeking out as well as young adults, the ones that are in their late teens, early 20s. So this is something on the rise again. Xylazine, this is a veterinarian medication. This is a newer medication. This is being used to cut heroin. It's an adulterant. It's a non-narcotic medication. It's a tranquilizer. On the street, they call it tranq. We see this a lot in the Montgomery County area, as well as the Westchester area. But it has a lot of symptoms of blurred vision, disorientation, drowsiness, like staggering. If you take too much of it, you can go into a coma. Your respirations get very slow because it's essentially a tranquilizer used to sedate animals. So this is something that is newer in the scene, but it's definitely prominent. Most people who use this drug are not going to walk around telling you that they're using xylazine. They're more than likely going to talk about using tranq. I want to bring up alcohol is still a drug of abuse that we see all across our programming. But there's a lot of things that draw some adolescent perspectives into this because the marketing again is very much kid friendly. Things like White Claw and Malibu Splashes and Bud Light seltzers, they're purposely made fruity to entice people to drink because a lot of times people don't like to drink, young people especially, because it's an acquired taste. And vodka is also a drug of choice for adolescents because they can back up with water in hopes that their parents don't notice. And they oftentimes add Skittles to give it some flavor so it's not so bitter. I just wanted to also point out that this is a big drug trend that we're seeing more recently is energy drinks. And again, this speaks to the marketing piece where you look at these things quickly, they look like standard energy drinks. But if you look closely and slow yourself down, you can see the number 21 on them. And that's how you know that these are energy drinks infused with alcohol. They have alcohol in them. These are being sold at the Sheets, anywhere, Wawa, anywhere that there is alcohol being sold. So these are something that is a trend as well. This is another trend. This is a growing trend in both adults and adolescents. Taking extracts, whether it's vanilla extract, bourbon extract, any kind of extract, and adding it to coffee. These extracts contain between 35 to 70% alcohol, which is a little less than a bottle of vodka. And people are going to have an overwhelming odor of coffee, but they're also going to get that sweet tint of like a vanilla or a bourbon that may be associated with a coffee creamer and not think anything of it. But this is a way people can drink while being in like a social setting and it not be like a soccer game, your kid's soccer game, or at school or at work. So this is a trend we're seeing as well. Kratom, this still tends to be a trend. This is a trend with people who are on probation, who want to try to beat drug tests. If you take this in high doses, it has the same effects as heroin. Lower doses, it has a stimulant effect, kind of like an Adderall, those types of things. So this is still a drug of abuse. You usually make tea with this and drink it, or people sometimes smoke it as well. Crystal meth is still a very big drug trend. This is oftentimes cut with other drugs. We are seeing this being mixed in with fentanyl. We are seeing this mixed in with other drugs, heroin, things like that. So it's not just straight crystal meth. This remains a big drug trend. It's usually white in color or like an off-white color, but sometimes it's pink or blue as a way to entice younger people or different, groups of people to use it. Heroin is still a big drug of abuse. We're seeing it packaged different ways than it was before. It used to be what was said to be in glassines, which is what the 7-Up picture is. These are wax paper tubes. The heroin would be added to it. They would be folded in half, and then they would be bundled together with small rubber bands, kind of like the rubber bands from braces. But now we're seeing heroin packaged in capsules. So these are empty capsules that are bought at like a nutrition store or bought online, and the heroin is added to them. It's a lot easier to transport. We've seen them transported in red and white capsules, which looks like Tylenol. Again, it looks innocuous. It looks like you have some Tylenol in a baggie. In fact, it's heroin. This we found in York County, but we do see this often, are trash cans. Trash cans is another way to transport heroin that isn't as obnoxious and like bulky as the glassines. These look like little paint by number containers. They're very small. You can see it as compared to the size of a hypodermic needle. They're usually a yellow color or a bluish color or clear. The heroin is put inside of them. You put them in your pocket and they don't stick out quite as much. Fentanyl pills. This is oftentimes the regular pills. So if somebody wants to buy Vicodin or Percocet on the street, people will take fentanyl, which is 50 times more potent than heroin, and crush it and smash it and press it into pills. These pills will oftentimes look like almost exactly like a Vicodin or a Percocet. And unless you really know what you're looking for, you're not going to know that they're not what you're trying to buy on the street. So fentanyl pills oftentimes have rough edges. They're not as smooth as pills that you get that are made in a factory. And also the color is usually a little bit off. These contain things like carfentanil, heroin, and fentanyl. And we've seen a lot of overdoses come from these. This is rainbow fentanyl. This is newer. This came out this week as something to be aware of from the DEA. They are color coding it in these rainbow colors as a way to try to entice younger people to take it, whether that's adolescents, hopefully not like preteen age people. But the DEA just put out a warning this week, and I wanted to just show you what that looks like. If you look closely at some of these pills, the green one down here, the edges are not clean the way a pill made in a lab would be, which would be your indication that these are not what they're supposed to be. Depending where you are in the city of Philadelphia, we still see a lot of crack and cocaine being the drug of choice for individuals seeking treatment. This has been something that is more regionalized as primary drug of choice, but we do see it in the Philadelphia area. And that is what I had to talk about related to outpatient and assessments and drug trends.
Amanda, thank you. That was really interesting. There's a lot of great information there, and I know we're going to have some follow-up questions. Thank you so much.
Sure.
Next, we have with us Sarah Weckerly. Thank you so much, Sarah.
Thank you for having me.
Absolutely. Sarah is a physician assistant, and I really enjoyed talking with Sarah on the phone. And I thought, wow, she's just such a great person to have with us tonight. I'll let you kind of give your background, and I just really appreciate you being here.
Sure. Thank you so much, Kim, for asking me. I want to hide my own view. I forget. I can't look at myself because then you end up looking at yourself the whole time. So everybody, my name's Sarah. I want to start by saying that I'm not a professional speaker or educator. So I haven't ever done anything like this, but I'm happy to talk about my experience. I have personally struggled with addiction and substance abuse, and I'll talk a little bit more about that. And then after entering recovery, I was able, to get myself together, and that led to a wonderful professional career where I have been working in emergency medicine as a physician assistant for the last 13 years. And myself being in active recovery, that has given me, I feel like, a unique kind of take on the substance abuse and mental health issues that I see coming in through our emergency department doors. I don't have Amanda, your presentation was so nice. I don't have a formal PowerPoint presentation. I just kind of have myself talking, but there were a few kind of points that I wanted to touch on. One is that I mentioned that I was in recovery myself, and I think it's important to note that I grew up in a really stable, very loving home with parents who cared about me. I felt safe and valued in the house that I grew up in. And my mom used to take me to get fudgesicles at the farmer's market on Fridays after school, and I had all of the opportunity in the world. My parents are educated, and you just wouldn't think that, how would I fall into this? Now, there's a lot of alcoholism scattered throughout my family, but it wasn't like directly in my household. And so that's important to note. And I feel like what my story was a lot about, honestly, what Amanda talked about. Like, I started dabbling with marijuana recreationally with friends, and that quickly escalated into like a garbage bag full of drugs. And I did a lot of drugs scattered, here and there throughout my high school years. And in 1999, I started taking OxyContin as prescribed by a physician for a pain issue. And within 6 months, I was hopelessly addicted and on my knees. And I entered into a treatment program, and thank goodness there was one for me. And I have been sober ever since. And that was in March of 2000. So I celebrated 22 years of continuous sobriety earlier this year. And one of the things that we're going to talk about even more, is reducing the stigma. And I feel like my story is a good kind of, I don't know what the word is, but you wouldn't think, right? Here's this girl who has all the opportunity in the world and all the resources and all the love. And I too, I feel like my story is like an after school special. You know what I mean? I didn't start using drugs because I was trying to escape anything. I feel like I started using because I was being social and we were partying, and it was the 90s. I don't know. I mean, kids are obviously still doing it, but I just feel like my brain just sucked, just ate up those chemicals. And I liked the feeling of being altered. And that just really escalated very, very quickly. And so when I think about reducing stigma, I think something that's important in that regard is that we continue to have empathy for people who suffer and struggle with drug addiction, because I know for sure that, I would say just about all of us are, we're not bad people. I think that we're people that have abnormal brains, and some people have normal brains and then get exposed to substances and their brains become abnormal. And I think that that's kind of my story too. And so I feel that it's important that we continue to have empathy and not look down on, and know that all of those people that are struggling are somebody's son or daughter or mother or father or brother or sister, and that it really can happen to anybody. And so I do think that that's important. And I want to talk a little bit about my professional experience, because I, in recovery, was able to further my education and go to graduate school. And I knew in graduate school that I was going to love emergency medicine, because I love exciting things, and emergency medicine is pretty exciting. And I couldn't believe how much mental health and substance abuse, patients I was caring for in the emergency department. I worked night shift for 10 years. And I feel like a lot of those things show up at night. And, Amanda's presentation before mine was a really good segue, because, she's seeing all these things, and I too have seen all of those things. And there's a couple of things that I think are important that I want to talk about as far as my professional medical experience. I have seen people intoxicated and struggling with addiction in all forms. I have seen all the things she talked about. I have seen people, many people come in, struggling with opiate use. I've seen people with polysubstance abuse. I have seen lots of alcohol, which I want to talk about a little bit more. And I've treated 5 and 3-year-olds who have gotten into the edibles by accident. I have seen a lot of hyperemesis. And for hyperemesis, this abdominal pain and multiple episodes of vomiting related to marijuana use that has gone up, I feel like, tremendously. One of the things that I wanted to touch on about all of this, treating these patients, is I want to talk about the family. Because I have a few cases that just come to mind where the family couldn't see it. I had a young girl whose family was taking her to be worked up for narcolepsy because she kept falling asleep all over the place, because they couldn't possibly understand that she could be addicted to opiates, and I had a mother whose 17-year-old son had died from an overdose, the year before, and I was treating her 15-year-old for an overdose, but he had only taken a pill. People think, well, I'm not doing heroin, but all the pills are heroin. Like, they're literally all fentanyl. Like, none of it's heroin anymore in my drug tests anyway that we've been running. It's all like only fentanyl. And that's really, really scary, because here was this 15-year-old who didn't have a habit. That's the thing that's scary too about the pills. And I just want to note that is that, some people become addicted to opiates, right? And they use opiates chronically, and they have withdrawal symptoms when they stop using. And other people use sporadically. They use under a party setting, and they don't really have this kind of chronic addiction, but they get these pills mostly and they don't realize that they're all fake and they all contain fentanyl. And these are people that are narcotic naive, and that's when people die. And that's really, really scary. And that story is a good segue into, I just want to briefly touch on Narcan. Narcan is an antidote to opiate overdose. It is a substance that has a higher affinity for the receptors on the brain, and it will kick the opiate out. And the primary reason people die from opiate overdose is it suppresses the respiratory drive in the brain. And ultimately, once people stop breathing, then eventually their heart stops, and that's what results in death. And so the Narcan is given. It can be administered multiple ways, but the over-the-counter method of administration is intranasally. So you take the sprayer and you just put it in the person's nose and squirt it up there. And I remember having a conversation with this mother whose 15-year-old had overdosed after her other son had already died, and talking to her about Narcan. Narcan is readily available over the counter. There's oftentimes community events where they will give it out for free. And I would encourage anybody who has, I have children that are still young, 8 and 6, but when they enter middle school, I plan on keeping Narcan in my house, like, just because it's a safe drug. It doesn't hurt you if you take it and you don't need it. And so I just don't really, some people I think feel that having it around may make it okay, to you, oh, I have the antidote, so it's okay if I use, and that in turn would increase use. I don't feel that way. I feel that it's safer to have in my home. If I ever were to find somebody, unresponsive, I'd rather squirt that up their nose with the hope that, maybe they had taken something at a party or something. So anyway, I wanted to touch on the use of Narcan. I am an advocate for that. I think it's something that, anybody with a young adult or teenage child should probably have in their house just in case. So I also wanted to touch on alcohol. Amanda mentioned that, and I just want to say, as working in the emergency department for 13 years, I feel that I have seen more. Alcohol is a drug, right? I have seen more alcohol-related things that I could ever tell you, from trauma to car accidents to broken femurs to chronic malnutrition. Withdrawal symptoms that are dangerous. Withdrawal from alcohol is very dangerous. People can die during delirium tremens. They can have post-alcohol withdrawal seizures. And so I just want to take note to say that alcohol is still very much a problem. I have intubated a college student to protect his airway. And so I think that that's just something that needs to be noted, just as Amanda mentioned. And it is true that it is, oh my God, the marketing. They're absolutely marketing to young people and trying to make it look appealing, and it can be so very dangerous. And it's still incredibly prevalent. And I think there's a lot of societal things about it that make it seem okay. And so that's something that I think is important. The other thing I wanted to touch on was, so I talked about family support, and I talked about how there's another story that another case that I just briefly want to bring up about a young woman who was intoxicated on opiates and had fallen asleep on a radiator and had very severe burns, like impressive burns. I wanted to transfer her to a burn center and she refused to go. And the important thing about her story is that she had convinced her partner that someone had snuck into the apartment and knocked her unconscious, and that's why she was asleep on the radiator. And the concerning thing to me about that was that he believed it. And so I think that it's just really important to have our eyes and our ears open and to think maybe, just maybe, my loved one could have a problem too. Because if we don't know that there's a problem, then it's really difficult to get people help. And on that same note, when we're talking about family and people who love those who are addicted, I think it's important to note that, like, they need support, family needs support. And I think that's so incredibly important. You can't will someone else into recovery. You can't, get them sober. You can't make them stop using. And I think that if anyone has people they care about that are really struggling, I just think it's really, really important that those people, while they're going through this, make sure they have support and fellowship and all of that to help them, through that process. Because the truth is, we don't know if their loved one will be able to get in recovery. I think there's resources and more people are going to talk about that. And of course, we want everyone to have all the opportunity in the world to try to get, sober. But I just feel it's really important that family gets support. In fact, the girl who was being worked up for narcolepsy, I spent a lot more time with her family, explaining addiction than I did with her, because we'll get her treated, but the family was really the one that I felt needed the help in that moment, because they just couldn't understand, what was going on with their daughter. So another thing I wanted to talk about when I'm thinking about the emergency department, it's just that things are tough. There are resources and we should tap into those resources. We have had a problem with lack of beds. And so I think the emergency department is absolutely a good kind of place to go. If somebody's really, really in distress, you're always welcome to show up on our doorstep. But I think that my hope is that we will continue to find other resources like partial hospitalization, IOPs. Certainly inpatient is a great option, but we need to have more beds. And so that can be really tough. It's really disheartening when I have somebody and I want to get them in somewhere and they're there and they're willing and they're ready to go and I don't have a bed for them. That's like really, really disheartening. The other thing I wanted to touch on as somebody in recovery myself, and also anybody else who may be in recovery coming from a medical professional or provider, is that I think we as the recovering person really have to advocate for ourselves and for our own recovery. And that's important because some of these drugs are medications, right? I got addicted to medicine and it almost killed me. And it was prescribed by a physician. The whole thing, my whole opiate addiction, I got from Rite Aid Pharmacy. And granted, like I was doing other drugs and I was a mess, but I'm just saying my opiate addiction was from a pharmacy. And so it's really important for people who are in recovery to understand that a lot of healthcare providers don't have a good understanding of addiction, and they often will prescribe medications that could be potentially really, really dangerous. And I think it's important to know that even a short prescription can open those floodgates in the brain and bring up things that had been, treated or in recovery for a long time. And I think people shouldn't just rely on their doctors to understand that, like, oh, it's safe, because it's not always safe. And so for me, I always make sure I advocate. I tell my healthcare providers that I'm in recovery. I'm not afraid or embarrassed to do that. And I have an understanding of what medications, I would be willing to take and what medications, I wouldn't be willing to take. And on that note, sometimes we're faced with things that we have to go through where we may be put in what might be a dangerous situation. And that's a good segue into something that I feel about recovery and how important I think fellowship is in recovery, and for me, I was really young. I was 17 when I got sober, and I needed people to hang out with that were not doing drugs because the biggest fear I had getting sober that young was that I wasn't going to be able to do anything, and I was going to be a wet blanket, and where was I going to go and what was I going to do? And thankfully for me, I entered into a 12-step program, and I know that isn't necessarily for everybody, but it saved my life, and it's why I'm here today, and I still participate, and it gave me a whole plethora of people that were in recovery, and I ended up having a really happy and joyful and somewhat, I mean, maybe more normal, I don't know, 20s, you know, where I was out and doing all types of things and enjoying myself and feeling social and not feeling like I was really missing out on anything. And that I couldn't have done that if I didn't find other people that were in recovery, and other people too that understood, you know, what I was going through. I think there's a lot of strength in numbers. And so I think being involved in something where you're with other people going through something similar, other people who can really understand from a personal level what that is like, I think that that's really important. And so those are the key talking points I think I had. I hope that seemed to be on par for what we were talking about today, and I'm grateful to be here. So thank you.
Beautiful. That was amazing. Oh my gosh, that you touched on so many really important things. Thank you. Thank you. That was, what a gift that you bring with both the experience of being somebody who's lived the life of substance use disorder, but now seeing it on the other side through that lens in the emergency department. I mean, that's your wealth of information and insight. So thank you very, very much, Sarah.
Thank you, Kim, for having me.
Absolutely. All right, great. So Claudia Herman, you are up, my friend. Claudia is the coordinator of the Montgomery County Community Recovery Center. Thank you so much, Claudia.
MCRCC. There's a lot of Montgomery County recovery things going on in the county. My name is Claudia Herman, and I am a person in long-term recovery. And I was listening to you, Sarah. You know, I was in my 40s and 50s when I had substance use disorder. And what I learned from that and how I ended up being at the Montgomery at ProAct is that at 57, I was like, this is not working anymore. I have 3 grown children who are in college, right? I live in a beautiful home. I work, I do, but my substance use disorder was running me. It became my full-time job. And finally, one day, I had to hit rock bottom. And then slowly, I went into recovery, and I'm here today to say I'm the best version of me now. So I'm the coordinator for the Montgomery County Recovery Community Center. So what we do is we provide recovery support services for people who are usually in the very beginning stages of recovery. We usually engage with them, our mobile CRSs, as they are when they're in treatment. We get referrals, and then what we do is we contact them once. And then once they're released from treatment, then we begin with an intake. We're a strength-based program. And so we do an intake, and then what we do is we work with them to develop an individual recovery plan. And it's like one goal at a time, one step at a time. And we're there to provide resources as well. So we're we talk about meeting people where they're at. And we do that literally and figuratively. And so our CRSs have lived experience as well. We all do. We're all in recovery at the center. And people come in, or we meet them where they're at, and we work with them. We provide them resources like housing in Montgomery County has become relatively difficult. But they need IDs. They come in disenfranchised, and they honestly believe that they cannot pull this all back together again. And what we show them is, yes, you can. We show them they have recovery capital. They can do this. And so we help them by getting IDs, getting their birth certificate, helping them with CYS, helping them reunite with their children, help them in any way they need. Our CRSs will be there to do it. But we also believe they have to put the effort in as well. It's like fishing. You give a person a fish, they eat for the day. You give a person, teach them how to fish, and they'll eat for a lifetime. And that's really the idea behind it, that we want you to be part of the process. And I say this to people all the time, I can't want this more than you do. This has to be something that you really want. It's 2 feet in. You just have to commit to it. My side of it is that I am the person who runs the center. I do all the programming. So all our recovery all our recovery programming, I do. So we have quite a lot, and I'm going to go into it. And we do events. We do a program called Adventures in Recovery. And what it is, we do a fun event every month. Go zip lining, play disc golf, go to a park, whatever. And the idea behind it is for people in the recovery community, especially when you're in that first month or two of recovery, even 6 months, you need to engage with other people who are in recovery. Know that you can make those connections. I mean, COVID did a number on us isolating and not engaging, but the idea now is that we need to come together again. And people are starting to come to our center. And what we find is people are still scared to engage. What I found right now in Montgomery County is like our drug court has 45 participants. That's it. And it's been the same number since February and January. So where is everybody? Where are they and what are they doing? Spring, summer, people do go out. They do and then it gets colder and they come back in again and they come into treatment. So that's something we have found that part of the landscape of substance use disorder and recovery is really happening right now. Referrals are starting to come in, but they're still coming in a little bit at a time. And we do orientations at Malvern, eventually at Eagleville, and at Valley Forge, Pyramid, but Montgomery County there's still a lot of barriers. And for us we were talking about all our recovery houses are in Norristown, in Pottstown now, not where we are, which is Norristown. And transportation is a huge barrier for the recovery community. And so we try, I give them out bus passes. We have a van. We'll pick people up. We'll bring them to our center. We're trying to do anything we can do to get people in recovery engaged in programs and engaged in services. So to tell you about our programs, they're hybrid, they're in-house, and so things like we do a women's trauma group, and the trauma group is for women who suffer from substance use disorder and are dealing with trauma. I am not a therapist, so I do not deep dive with this. We do beyond trauma. It's a different curriculum. It's a curriculum where they can work together. It's very tactile. We do vision boards, we do drawings, and they get to express themselves not just verbally, but through other methods of communication. I do smart recovery on Thursday mornings. I had 20 people in my group today. And they are doing multiple pathways. They still can do AA, NA, Dharma, whatever they want. But I find the smart recovery group keeps growing. And more people are they're starting to connect with smart recovery, which is great. I love it. We do a family program at our center, all our centers, and our Bucks County Recovery Center actually has a family recovery community center now through ARPA funds. And so we're hoping that our center eventually will have it as well. I am a firm believer that it takes the family and the individuals, whoever it is, it takes everybody. You can't forget the family. You have to support everybody. And when I can get them all together at groups or in events, it makes such a huge difference. We also are going to be doing 2 programs with Family Services of Pottstown. One is a group for, I think it is 12 weeks, where these are parents who are now in recovery, and they work with them to teach them how they can parent being sober. And then we'll be doing a triple P program as well. And we do a Wellness Wednesday program. It's in-house. We do guided meditation, and we also do nutrition for recovery, as well as recovery art, recovery games, another way for everybody to come in and engage. We do a drum circle at our center on Mondays, twice on Mondays. And what we found is drum circles is just a form of mindfulness and meditation. And people love doing it. In our box office, we've got a line of people coming in to do drum circle. So we're looking for ways to engage people who are navigating recovery in not all the traditional ways that we're all used to, but trying to find different ways to engage them, bring them in. And the big part of it is having a non-stigma, non-judgmental setting. So when they come into us, you can see in their face, I'm here, but I don't really know why I want to be here. I was told by my PO I have to be here. And then they come in, we do a program, and it's a reentry program called Gateway to Work. And it's a 3-day program, once a month, for 3 hours a day, where we help people come in, we get a handle on what their job history is. And many times it's very inconsistent, and that's okay. We tend to look at what their recovery capital is, and we take it from there. And we help them to create a resume. They're doing it. We're just helping them. And then we get them online. They look for jobs. And one of the things that is a reality with people with individuals in recovery, including myself, is that how do you overcome? Many people have a criminal record, whether it be a misdemeanor or a felony. And how do you overcome that when you go to interview with people? Because other than Philadelphia, which seals now, I think, a lot of records, Montgomery County does not do that. And so the first thing they ask is, how am I going to get a job? I said, well, you can't lie. You have to be honest. You have to have transparency. But there's a way to do it. And so we look at making functional resumes. We help them to deal with the question of what happened. You have a record. And I said, don't focus on that. Tell them where you are now. Tell them what you're trying to accomplish. Tell them the successes that you're having. And if you can move away from all of that and move into who you are right now in the present, many times they will get a job. We have second chance employers. We have employers that take individuals who have felonies. And I would tell you about 75% to 80% of the time, we have a lot of success. I mean, it's one of those things where you just have to keep trying. So we do that. And we do I use volunteers for a lot of the things that we do in the center and the resource tables we do in the community. And I have found when people come to our center and they volunteer, they begin to feel empowered. They feel like they have a sense of purpose. And they take ownership for being in our center. And I watch people go from, all right, I was told I have to do community service, I'll come in, to, can I facilitate? Can I become a peer mentor? Can I become a CRS? And I have seen countless volunteers come in from, I know I have to be here, but I really don't want to I want to volunteer. I want to be doing community engagement. I'd like to be a CRS. How do I do that? And I just watch a lot of our volunteers bloom into people that they never thought they could be. And for me, that's a very big part of why I love doing what I do. And when people come in, the first thing I say to them is, no judgment here. We're all in recovery together. And I don't care how many years you have, months, days, we welcome you in with open arms, and we want you to become part of the Montgomery County ProAct family. And we also do events. I will be doing a Lights of Hope at the Elmwood Park Zoo. We do a memorial for the people who have passed due to overdose. And we celebrate all those who are navigating recovery. And I say bravely navigating recovery because it takes a lot of courage to do it. And we will be doing luminary bags. We decorate them, we spell out hope, we just connect. We have a keynote speaker. This year it's one of our staff who is a person in long-term recovery, as well as she has a daughter who passed from an overdose. And we're going to have an overdose survivor who was one of my volunteers and then decided to move to Schuylkill County, raise his family, and be a CRS. I couldn't say no. Of course, he had to go. And we're going to actually have pretzels made like a ribbon. I'm just so excited about it. It's an amazing night. It's very impactful. I can honestly say people in recovery are just the coolest people I know. And if I had my choice about hanging out with this person who's not in recovery and hanging out with somebody who is, I always go the other way. It's a funny story, but my boyfriend, never in recovery, lived in Berks County, lived on a farm, had no idea. And now he's like my number one volunteer. He is so engaged in it. He thinks it's amazing. And I view sometimes what I do through his lens. Because, when you're doing it every day, you tend to forget sometimes what an impact you can have on people's lives, especially in those early stages of recovery. So it's a lot of what we do. Kim, I have calendars, I have flyers. We are doing a walk because we're not doing our big walk this year for recovery walks. So for anybody in Montgomery County, we will be walking in Norristown. I will be having a breakfast at our center starting at 9:00 on September 17th. And then we're going to watch the virtual walk for the council. So let me backtrack. I work under the Council of Southeast Pennsylvania. All our PROACT centers, we have one in Bucks County, we have one in Philadelphia, and we have an office in Chester, and we have our center in Montgomery County in Norristown. Usually we do this really big walk at Penn's Landing. We had 30,000 people the last time we did it. But due to safety reasons, we erred on safety and decided to do local events. So we will be in Norristown. We're asking everybody to wear red. And we are going to walk after the virtual walk and show the people of Norristown, the residents, as well as the business owners, that this is what recovery looks like. It's the person next door. It's the person who walks into your store. It's the patient that goes to the doctor. We're recovery. We're like everybody else. Our brains work differently. And, we had to do what we had to do to get it to the point where we're operating like everybody else. And so that's what we do. We're in the heart of Norristown on DeKalb and Marshall Street. And we just welcome everybody in. And if we get somebody who we feel is not appropriate, based on dual diagnosis, what their primary diagnosis might be is mental health, we will actually work with them and see where we can refer them to so that they will be in the right place, getting the right amount of help. So as I do with my Smart Recovery and all my events and all the programs that we do, I always put my email in chat and I put my number and I say to anybody who needs help, needs to talk, needs resources, give me a call. We also do a recovery support chat Monday through Friday from 9 in the morning till 9 at night. People can come on the chat. People from our Warm Handoff program are there at night. And we also do that. We do it in Bucks County and Philadelphia. We do a Warm Handoff program. And Sarah, when you were talking about, working in the emergency rooms, right? There's still so much education that needs to be done. Because there are a lot of people in the medical community who really don't completely understand what's going on when a person comes into the ER and they're in crisis. And I hope we get better at that through education. We also do a training called Taking the Stigma Out of Language. And we've done it for all of adult probation of Montgomery County. And we are going to be doing another one at the Montgomery County Community College for both campuses, for the instructors, as well as the students through their wellness program. So we have a lot of resources at our center. And we encourage everybody to come use them who is in recovery, contemplating recovery, and everything is free with the exception of our recovery support services, our CRS services. That's fee for service, and we do take Medicaid. If a person does not have insurance, we will still work with them. And if we can't get them insurance, which usually we can, we have a peer mentor who is a certified family recovery specialist who will work with them as well for free. So we're there to help everybody.
Claudia, thank you. I'm like your boyfriend. I'm a recovery groupie. That's what I was labeled by a therapist friend of mine. He's like, you're a recovery groupie. I'm like, I am. You're so right. There's so many beautiful things. Thank you. That was a lot of great information. Thank you so much, Claudia.
Thank you. I'm glad to be here.
I'm glad you're here. Okay. And last but definitely not least, we're so happy to have you with us, Andrew. I'm going to turn it over to you to share your experience, strength, and hope. Thank you.
I don't know, it might be least. Those are hard acts to follow, right? I'll say, what I can say is this, is that I think it's kind of great that the other two speakers and the person that obviously had the great PowerPoint presentation, by the way, which obviously I do not have it either, that, you see three different people in three different situations and you see so much going on, right? For me, my background was a little different. I was adopted. I did end up knowing who my biological mom was. And there's just, she adopted me to her brother, which was in the military. And after 9/11 happened to be gone a lot, right? Still, he just retired, but still training people today. My mom always worked, and the closest sibling, I guess you could say I had, was 7 years older than me. So by middle school, it was kind of like, I kind of learned how to, clean the dishes on my own, cook my own meals, kind of handle things. As far as addiction coming along, I think it's strange because I hear all these things, and one of the things I can kind of remember, actually, I can remember a lot of it. The main thing is I think I was always trying to find my identity. I think I was always trying to find out who I was as a person. And with that came along, you go to school, there's the influences, and I don't think this is something you can nail down with one thing. A lot of people have come and gone in my life. I'm originally from down south, so I'm not actually originally from this area. I grew up from 3 to 17. I was born in Tampa, Florida. I grew up from 3 to 17 in Fayetteville, North Carolina. I moved back down to Florida. I've been everywhere down south, from Georgia to Louisiana, Texas. You kind of call that south. It's a little west, but South Carolina, all of it. So Alabama. And the funny thing is, when we were having our pre-talk before this started, I remember Amanda telling me about how things were regionalized as far as the substances go. And that's kind of everywhere. I've traveled a lot. I've been to a lot of places, seen a lot of different people, come from a lot of different backgrounds. And it's funny too, because Claudia talking about, when people are struggling with, getting in trouble with the law. I have 7 felonies, right? I've been in jail. I've been in prison. I don't like to use this too much, but just so people that don't quite understand, or I shouldn't say don't understand, but haven't been through that experience, I guess you could say it's a rock bottom, right? But I like to say, it can always get deeper. Rock bottom is when it's all over, you don't open your eyes again. And that's something that's very real, and it happens. Education-wise, I think that, education is very important. My story kind of goes, I just kept getting involved with the wrong people, kept trying to find out who I was as a person. Of course, very similar to Sarah, I started out with marijuana and drinking. As goofy as this is, I did the whole, 40-ounce thing. I smoked the weed, of course, or marijuana, is much stronger than when I started. There were still sticks or stems and seeds in mine when I first started. The main thing is that, but I started at a very young age, middle school. I guess I always kind of hung out with older kids. So my life kind of rapidly grew. Of course, it got kind of out of control by 16, 17. I was, of course, with a rough crowd, with a rough group of people. And at 16, I was tried as an adult for breaking and entering. And from there, I was able to kind of skate through on probation because it was kind of the first time I got caught, I should say, and went back down to Florida, and that's when like the pill mills were really big. That's when like people were getting fake MRIs, me included. That's when like Roxy's, or I guess Perk 30s, what they called them up here, were really big. Of course, I got very involved in that. I was on my dad's insurance, which was TRICARE, so medication was very cheap. So it was very easy for me to run around, and I ran all around Florida. And things, of course, get out of control, but I wasn't one to bump my head once. I bumped my head multiple times. Of course, I got in trouble with the law, still got back out there. When I got my first felony, I remember thinking like, well, that's it. You know what I mean? I don't have much of an option. And I think it's very, very surprising where I'm at today, and I'll get to that. But from there, that hopelessness comes in, and some people take hopelessness and they see it as a rock bottom. They think, hey, I got to see what's on the other side, and others give in. And I gave in, and I thought I was nothing, and I would be nothing, and there was no future, and I'm just going to do what I'm going to do, and that's how it's going to be. But eventually, you kind of get tired of it. I know for me, it was like Claudia said, it was like a full-time job, right? Like it was all I did. It was all I started to know. All the education I went through, everything I was interested in, all just became something in the past. And it wasn't just, drug addiction, it's a disease, right? For some, they say, it's a generic thing. I'm not very educated on this, but my family definitely does have a history of drug use, especially my biological mom. And for some, they say it's like type 2 diabetes, right? Like no one's born with it. But once you cross the line, once certain chemicals have been mixed, something happens to where this becomes an everyday struggle, and you have to treat it. For me, though, I think to make the kind of the story part, and I apologize, wasn't too prepared for my story today, but long story short, I ended up moving up here with my biological mom to get out of everything I knew. I figured, hey, different place, different scenery. I'm going to be able to change things up. I'm going to be able to become a new person, and I'll figure it out. Of course, down south, I learned how to become a bartender. So I worked in restaurant businesses for a long time. Front of the house mostly, never back of the house. Started out serving tables, all that. But I came up here, I figured I'd get a fresh start, and my biological mom, who was also addicted to substances, kind of hustled me a little bit, right? She said she found a new place, needed a down payment. I gathered some money up, come to find out she was getting evicted. And I ended up here kind of stuck, found a place in roommates.com. Like, yeah, that's you kind of take what you can get once you get to that point. Still went to my job. It was Cantina Loretto and King of Prussia Mall. And it turned into a Buffalo Wild Wings, I believe now. But at the time, it was a Mexican restaurant. I bartended there for a while, served tables. And but eventually it was just all kind of dead end roads. Afterwards, I'd always go out and drink, or I'd always go out and party, or I'd always go out and do something. And what I've learned from all of this is that I was seeking something. And that goes back to the thing where it was like finding my identity. It felt like I could never find my niche, people. I could never find my group, my crowd, people that would understand me, and it always felt like I was trying to fit in. I can also say that through that process, of course, I got in trouble up here, because that's what I do. I get in trouble. And, I went to court, and, I went to jail for a little bit again. And when I got out, I still had 2 paychecks, because up here, it's a little different than down south. When someone tips you on their card, you get it put on your paycheck. Down south, that's not the case. You always get cashed out. But so I guess lucky for me, I had 2 big paychecks waiting for me when I got out. And I thought, I'm going to find a cheap motel. I'm just going to start fresh. I'm going to figure this out. Of course, I know nothing about Philly at the time, and I end up in Motel, I believe, USA on like Broad Street in Allegheny. Now, I'm sure you all know about that, but at the time, I had no idea what that was. I learned very quick that up north is a little different than down south. Down south is more underground. Up here, it's more open market. That's about the biggest difference. Other than that, though, as far as the scene, for me, it's all the same. But to kind of push forward a little more, I would say that I did get to that point, that breaking point. I did get to that point where I had no support. I had nothing left. And because I moved up here trying to get away from everything, I didn't know anybody. So it came down to like, I had to figure something out. And I never went to rehab before, because to me, it was like locking myself up again, right? Talk about stigmatism, right? Like rehabs, like for people that are struggling with the substances, you don't want to go to rehab. Like, why would I want to be told what to do? And, some people who are struggling with addiction probably been told what to do their whole lives. That's the last thing they want to do, just with people I've met and helped along my journey. So I finally went to rehab, and I did go to a recovery house. It's called, Sunlight of the Spirit. It's in Montgomery County. And from there, my story goes, you had to, something about, discipline. It's like when I started using, it's like my mind did not develop into adulthood, right? Like it was almost as a kid's mind. And one thing I learned about my 3-year-old child is, I'm starting to learn anyways, is that she does crave discipline, right? And I find out that discipline really helped me along my way, but it had to be presented the correct way. It couldn't be, just, hey, you're this, that, and the third, and this is what you're going to do. It had to be like in a kind and loving way. And I didn't think that was possible, but it was. And some of the things was that I had a chore every night. I had to make my bed. I had to keep my room clean, and I had to work because I still had to pay rent, right? Like it was a recovery house. You still had to pay a certain amount a week. And I found a job at a diner, and, I was dining tables, and no offense to up here, but I guess customer service isn't like down south, because, I kind of brung my little twang up here, and I happened to get regulars like it was nothing. And eventually, I saved up enough for a car, right? And I started building my life again. Now, another important thing that I had to do in the recovery house was I had to go to meetings, and I had to get a sponsor, and I had to work the steps. Whether I liked it or not, I understand like some people might feel a type of way about it. I understand that people gotta want it. You can't force anybody into it. But when you're down and out and there's no more enabling, and this is the last place to go, you kind of give it, an open-minded view, right? And I can say that, I did get a sponsor. I started working the steps. I had no idea what the steps were. And when I first looked at the steps, I just thought, I just had no clue about how this could help me. But as you're working them, they're nothing like what I thought they were. And after going through the steps, I can tell you that anybody could use it. It's not about alcohol or drugs, right? Like it's about the deeper underlying issues, which brings me back to my point of trying to figure out who I am as a person, like who I was. The main thing is that, you get to that 12th step and you think, maybe some people think you're finished, come to find out, like, going through the book I went through, no, it's about, taking somebody else through the steps. It's about giving back. One thing I learned is that, I was very selfish and self-centered. Somewhere along the way that happened, and I let it grow into a monster, and that's who I became. Very selfish and self-centered. No matter what kind of bad things happened to me, no matter how bad my cards were, at the end of the day, I made worse decisions, or I used it as an excuse to get what I wanted. That's just who I was, and that's my story. And honestly, through my job now and what I do today, still a pretty similar story. A good friend of mine told me a story about, imagine two people going down an alleyway and they both get harmed or something happens to them, right? You have one that, sits there and goes, oh man, look what happened to me. Now, don't get me wrong. It's a very traumatizing thing. It's a very horrible thing, and things do happen, and it's bad, and they have the right to their feelings. And I get that. But one person, takes into that and thinks, look what happened to me and I need this, and kind of makes it more about themselves. Right. And what ends up happening is they don't find a solution, and they can kind of get more wrapped up into themselves. And it even comes to that monster I was talking about earlier, where it becomes the excuse. It becomes the reason behind everything they do. And then you have another person that goes, you know what, I'm going to warn people about this alleyway. I'm going to help people that went through this alleyway like I did. I'm gonna try to do something about this. Which, by the way, Sarah, I salute you, because your job's got to be just unbelievable. I'm glad there's people out there that want to do what you do. But anyways, there's a difference there. And when I started learning these stories and I started hearing these little things, I started realizing at the end of the day, there's something I had to do about it. Now, I know this is more about, changing the landscape, and how can we, better help a person better understand, or even a parent or a daughter or a son or a cousin or anybody who's not struggling with this, can they help their loved ones? And when you hear, the truth is, you can't really, push them into it or anything like that. You can't force them, right? But something, I can't say I'm an advocate for it, but I think something that really helped me along the way, and it's the hardest thing you're going to have to do, is not enable. You can be kind, you can be loving, but you can't enable. You can't, and you got to be, even if a person was falling asleep a lot and they fall, and I pronounce it radiator, so forgive me, but even if a person falls asleep a lot, or whatever the case may be, something's wrong, right? Something is happening and something needs to be fixed. There needs to be a solution to it. And that goes back to the feelings, right? When I say everyone has a right to their feelings, that's 100% true. But with that said, my feelings aren't facts. If I let my feelings run how I want to do things, if I let my feelings kind of get in the way, and this is just for me as someone who struggled, I start getting lost a little bit. There are certain things that in life that do add up, right? There are certain decisions, and there are such things as consequences. Like I said, the biggest thing I can give to a loved one that has a loved one that's struggling is, don't enable, be kind and loving, but don't, and definitely get educated about this. If something doesn't, trust your gut feeling, right? If something doesn't feel right and you think there's no way in the world this could be happening, I hate to say it, but at least I'll give it at least a 50-50 shot it could be happening. Another thing too is that something I recently went through. I had a wife who struggled with addiction as well, and she's recently had a relapse. And she's a therapist, and she has all kinds of letters behind her name. right? She's very educated in a lot of this stuff, and you would think something like that would never happen. Someone who struggled with addiction and someone who had to go through what they went through to get to where they're at today, still couldn't see the signs. So, look on me, right? Like I help people every day. I mean, the job I'm in right now is dealing with patients every day who struggle with substance abuse. So the fact that it still got kind of slid under my nose, you got to be aware. This isn't to be paranoid, though. This isn't to go, hey, this could be happening or that. But it's one of those things where you got to be aware. And I guess really what it comes down to is, like Claudia was saying, like try to stay educated. Try to learn from others. Keep an open mind. As far as the stigmatism goes, I would say this: there is a lot of stigmatism. I wish the stigmatism would go away. A couple of things I will say though is someone like me, I probably helped with that stigmatism, right? If I was going to be completely honest, I did bad things, like I said, I got in a lot of trouble. And that's not to say like, hey, look, I'm a bad person, because towards the end of this, I'm going to tell you some good news. But there were some things I did and I had to make them right. And that's really, I guess this message is more for anyone that struggled like me, like there's some things I did and I had to look in the mirror and I had to get things right again. And I had to face my consequences. I had to keep my side of the street clean, and boy, oh boy, was it dirty, was it messy. Today I can tell you this, I have 6 years continuous recovery and sobriety. As far as material things, just to kind of go through it, as y'all heard, I started on Allegheny, right? Like Broad Street, Allegheny. I live in Montgomery County. I live in North Wales. A recovery house I stayed in was the beginning, my journey of my recovery. I bought that house. It's where I'm raising my daughter today. I have a good job, a good career. I have a good resume that I can take anywhere. And that's a person with 7 felonies, right? That's a person that's been in and out of jail and in prison twice. So to all the loved ones, I just want to let you know there is hope. There's really no excuse. Understand that the cards can be dealt in a bad way sometimes, but as you can see with these people surrounding me right now, there's people out there trying to help, including me. I still look out for sponsees, I still go to meetings. I'm actually going through my steps again, because maybe even through my 6 years, sometimes, you can get a little lacking, and I got to remember what got me here. If I forget that, I could not drink or drug again, but still be miserable. I could still be discontent, right? And I have to make sure that, I got to remember what got me here today. So sorry if I cut this short. I'm not sure if I did or not, but I will say that I'm very thankful for everyone here. It was very educational for me, and it's something that I want to look into more. So thank you again for having me, Kim, and I appreciate the time.
Well, thank you, Andrew. We'll definitely stay in touch. I'm so glad that you were willing to share all that. Thank you. That was a really beautiful story. Congratulations to you and to everybody in their recovery. That's really what a very uplifting group you are, I have to say. There are a couple of questions I'm going to get to. We have about 10 minutes left. So I'm going to ask one question, Claudia. This is for you about someone's looking for a similar program in Chester County. You mentioned that there is a recovery community center in Chester County. Can you touch on that briefly? Oh, you're muted.
Gosh, I do this all the time. You would think after 2 years of this, I'd be really good at it. No. So we have a Chester County office. It is not a community center. We're not doing groups there, but we do recovery support services. If you want information, I can say our coordinator is Lindsay Hendrick. And if you want my email address, if you email me, I'll be able to give you all the information that you need. I just don't have it at my disposal. So if you want my email address, Kim, do you want me to put it in chat or?
Sure. And I'm going to have all this follow up on that page. So you can go to conversation.zone/addiction or conversation.zone/landscape. Judy just pointed out that they're both up, but I do need to update them. So I will put all of your, I will put your contact information, Claudia, and
Okay.
Sarah's and Amanda's. Andrew, it's up to you if you want to share yours as well. I'll leave that up to you. But yeah, anything you want me to share? And Claudia, I put a link in the chat to you.
Oh, okay.
Best
Okay.
place for people to
Best
find.
place to do it. Okay. So I will make sure you get that and give you that information. They're in Exton, near the Exton Mall, and we do have an office there. And the coordinator is Lindsay Hendrick, and she has 3 CRSs who are mobile. So if you're looking for services, we definitely have something for you.
Awesome. Great. Thank you so much for that. There's a question I was hoping you could address, Angela. It's about Amanda. I'm sorry, Amanda, about detox protocols. Someone asked if have the detox protocols changed due to these additional substances like xylazine and fentanyl and so forth. And if so, how does it work? And if not, when will they be changing? This is such an important thing, according to this person.
So definitely the detox protocol for xylazine is different than a traditional detox protocol because of the half-life of the substance. So that is something that is important to note. I will concede that I am merely a social worker. I don't know exactly what the detox protocols are. I do know that we have standing withdrawal management protocols at all of our programs where we offer withdrawal management. These have changed as substances change, and as medical assisted treatment changes, we change our protocols as well, because they're starting to treat methamphetamine abuse with certain medications that they didn't do before. So as all that changes, we change with it. We have to. If we stay stagnant, we're not serving the people who need us the most. So we do change our detox protocols as warranted.
Right. And I wonder, and Sarah, you might know something about this as well. Obviously, with fentanyl being in almost everything these days, that if someone thinks they're using heroin, as you talked about, we know about Narcan, or hopefully most folks know about Narcan, and you talked about the importance of that. But so many people also realize they need multiple doses of Narcan in some cases. And also, it's very important to note that if xylazine is involved, Narcan is not effective with an overdose involving xylazine. So, Sarah, do you have anything to share about?
Yeah, well, I mean, you basically said it. So Narcan is only a reversal agent for opiates. So if you find someone unresponsive and you think that it's substance abuse related, you can certainly give them Narcan. If they are intoxicated on something other than an opiate, the Narcan simply won't work. And it is true, especially with fentanyl, that sometimes you need multiple doses, 7, 8 doses to try to get somebody back. I would say if you find somebody who is blue and first thing to do is check for a pulse. If they have a pulse and their respiratory rate is very, very low, like 4 a minute, you can certainly give them some extra breaths. You can give them mouth to mouth to give them extra breaths if they have a pulse. And certainly if they lose a pulse, then you should start CPR and obviously call 911. But
Wonderful. Thank you. Claudia, I wonder if you could talk about access to Narcan, or anybody who has information about that.
We keep Narcan in our office, and we also have Distera, which is an agent. It's like it's in a package, and you can put it into pills. Like if you want to throw out your medication, and what it does is it deactivates it. So I'm going to have that in my center now. Neda Soltani, who you know from drug and alcohol, we do a lot together, especially Narcan trainings. And so we were in Pottstown, and I was giving away boxes of Narcan. You can come to our center, and we will give you Narcan. We just log it in, and you can have it. Every event I do now, I bring Narcan with me to give out. I have found that we were out for International Overdose Awareness Day in Norristown giving out Narcan. So if somebody's looking for it in Montgomery County, call me and I would be more than happy to give it to you. We always have Narcan. If you are not necessarily near our office, you can call the Office of Public Health and Safety, or you can even call the Office of Drug and Alcohol in Montgomery County. You can ask for the Opioid Task Force. Usually you will get Netta, and she will find a way to make sure you get Narcan.
Great.
And can I add one thing about that, just
Please.
very briefly? I just, as Claudia said, she is going to have access to a deactivating agent, and I just want to make a PSA that we shouldn't keep narcotics in our house that we don't need. So if you have ankle surgery and you have leftover Percocet because you got through it, you should dispose of that medication, and you should dispose of it in a safe way with a deactivating agent, or county oftentimes will offer, they'll take your medication and dispose of it safely. So you really, they're not safe to have in the house. That's
They're not. And you know what, Sarah, we're getting pill bottles from one of my contacts who's the coordinator of training in drug and alcohol, and she was at a conference, and they now have like the pill containers, but there's something with them that they change color and you can lock them, and then you can dispose of your medication. The concern is that you're disposing of the medication, it's in the trash, and people are going in there like fentanyl patches and those type of things, and they're using them. So we're trying to come up with ways so that you do dispense it and you dispense it safely. I also have lock bags that if somebody wants to keep that in their house because they need to keep their medication, but they want to keep it away from their children, from other individuals, I actually have bags that they can actually lock up their medication and only they could get into it.
Right. And most police precincts do have those drop boxes as well, which is a good place to dispose of those also.
Yeah.
Sarah, I think this might be a good one for you. Is there medical treatment for cannabinoid hyperemesis?
Well, the first thing to do is to stop the offending agent, which is the marijuana. The struggle that I have is that the people never believe it's the marijuana. They want it to be everything but the marijuana. So the truth is, and the other thing I want to say about hyperemesis is that it appears that once a reaction starts, it lasts for several days, 2 to 3 days. And they'll say, well, I haven't smoked in 2 days. Well, you're still having the same reaction that you had that started 2 days ago. So the first thing to do is to stop the offending agent. And the medication we've been using to treat it that has been most successful is actually Haldol. Haldol is an old, typical antipsychotic medication. It's very sedating. It works for neuropathic type pain, and the GI system has a lot of serotonin receptors. And anyway, so that's what we've been using. We have found traditional anti-nausea medicines to be very ineffective. And as Amanda noted, it is associated with a lot of pain. People get a lot of abdominal pain with it, but we're really trying to avoid using opiates and narcotics for treatment of that. So my greatest success has been with Haldol. Haldol is not available over the counter. It's a really sedating, very potent drug. You have to get it at the hospital.
Got it. Thank you. Great. One more question I'd like to get to that was asked in advance. What are some post-resident, maybe Amanda, you could talk about this, some post-residential treatment options for young adults, also resources for families of those with addiction and mental illness?
So, there are a lot of outpatient options. There's partial hospitalization, which is a great step down from a residential program. Oftentimes we see people go from highly intensive services like a residential program to like 1 day a week, and that doesn't really work. They need the extra support until they get connected to programs like Claudia's program and these types of things. That doesn't happen overnight. The next outpatient level of care is intensive outpatient services. That is services of a minimum of 9 up to 19 hours of group therapy per week. And then stepping down to an outpatient group, which is 2 hours, 1 to 2 days a week. And then we have individual therapy as well. Also in outpatient therapy is if there's co-occurring conditions such as mental health or trauma, is getting those addressed as well at the same time, so that all of that piece is, we're treating the whole individual. We're not just treating substances, we're treating all of the triggers and then giving them the best chance of being, substance free. So.
And I can just touch on very briefly the question about for resources for families with it who love someone who struggles with addiction or mental illness. Those parent partnership meetings that I mentioned at the beginning are great. They really do focus on substance use, but the boundaries and the codependency and all that comes along with this is just as relevant for someone with a mental health challenge as it is for someone with a substance use disorder. If you're not necessarily a parent, there's Al-Anon, there's Nar-Anon, NAMI has some great support group meetings as well. So, again, we have lots of resources on our website for the family member support as well. I know we're at 8:31, so I want to let everyone go for the evening, but thank you, panelists. You were amazing. I mean, I'm so grateful. I'm just so grateful to all of you. You're just phenomenal. Thank you all for being with us. And don't forget that survey at the end when this concludes, and the follow-up will be there in the morning for you. Thank you very much, Andrew, Amanda, Claudia, Sarah, Judy. Thanks all.
Yeah, thank you so
you.
much. It was really nice meeting all of you.
Yes, definitely.
Very
Thank you,
nice meeting
Kim.
you.
Nice
Yes.
meeting you guys. You have a great night.